co-chair, Sandeep Budiraja. First of all, thank you, CAHOCON, for inviting me. And thank you, Sanjeev, for giving me the opportunity to speak the last word. This actually means that all those who are unimportant have already left, and only those who are interested to listen are still here. So the last lecture also has one other advantage. I don't think I'm going to hear many buzzers if I overstep the time limit. I would like to congratulate my friend and my classmate from the last 53 years, Dr. Vijay Agarwal, on being elected the president of CAHOCON, and I wish him and the organization all success. The topic that Sanjeev gave me was quality beyond accreditation. And when I thought about quality beyond accreditation, the thought came to my mind. That was, what does the patient want? The patient wants good clinical outcomes. He wants either free or a price that he can afford, and a price that is transparent. The third thing, the patient is looking for a good experience, which is what we call the soft skills, a lot of which Sandeep just talked about. So there is a hotel part to healthcare and there is a hospital part to the healthcare. The service excellence piece constitutes the hotel part, and that doesn't really apply in most of the government institutions. But the hospital part is what the patient comes to you for. And if you put yourself as a patient, you'll realize that the only thing that you look for is, am I going to get well? So what is the outcome going to be? Now, clinical outcomes, the important part about clinical outcomes is, I think there is a zero outcome. Sandeep's word has been heard. Nothing is coming in. Okay. It's the result of care in terms of patient's health over a specific period of time. What is the outcome include? It includes discomfort, timeliness of care, complications of care, patient satisfaction with health. It's the full cycle of care that we are talking about when we talk about clinical outcome. It includes the health results which are relevant to the patient, and that's what he's most interested in. But when we measure clinical outcome, we also need to do what we call risk stratification. The value proposition in front of us when we talk about clinical outcomes is basically that it must follow certain globally agreed upon or accepted evidence-based measurable changes in health or quality of life resulting from the intervention that we are doing. And the reporting of outcomes and its continuous monitoring must provide us with an opportunity for assessing and improving the care that we are providing. This is a slide that one of my colleagues, Dr. Gurvinder, who's sitting here, made, and I think this encapsulates just what I'm talking about. Clinical outcomes are really central to everyone, including the patient, the clinician who treats, the brand that the hospital might have, the department, and the payer. So in Fortis Healthcare, and I must admit here that this is not the work that I did, but my colleague, the Group Medical Director, Dr. Vishnu Paningre, who is quietly sitting there, he should actually be here presenting this work. But it was his brainchild that resulted in this forming. Now, how we started in Fortis was basically a lot of brainstorming sessions with stakeholders, resulting in specific procedures that we wanted to measure. This result was the outcome of the case mix that we get, the procedure volumes, and the organization's focus area. This resulted in us focusing on coronary CABG procedures, PTCA procedures, and knee transplants, because there was sufficient data and material available with us for these to measure. So our journey really was resulted in a portal being developed and tested, key result areas being developed, and a culture of change management, which resulted in a pilot being started in late 2013, early 2014 at Fortis Escorts Hospital in Delhi. The rollout occurred in other hospitals over a period of time. This is how the Fortis Clinical Outcome Portal looked like. It including things like emergency CABGs, total PCI, etc., etc. The point that really came out was everybody will do exactly the same thing. Any hospital worth its salt will do exactly the same thing. So what were we doing that was different? That is the question that each one of us wanted to ask. Enter this gentleman. I think if this was a quiz, you'll all recognize him. He's Michael Porter. He's the Bishop William Lawrence University professor at Harvard Business School, which is the highest recognition Harvard gives to anybody who's in Harvard. And you all know him and his work in economics and in health economics, as also in healthcare, is something outstanding. Now this man had the same idea, that what the patient wants is clinical outcome. And how do I make clinical outcome acceptable to the world? Let's be very honest, we had a session on data management, and we were talking about why data is not collected, if it's collected, why it's not dispersed, if it's dispersed, can I rely on it? That's the key question. We all know that in every field, either in governments, public or in private, for one reason or the other, either data is not collected, if collected, it is not disseminated, if it's disseminated, it's not analyzed, if it's analyzed, can we trust it? Everybody pads data. Honesty is not something that is a unique characteristic of us, sadly. And therefore, this question came to us as well. That if we were to bring out our clinical outcomes, who will believe it? They'll all say, oh, that's the ego of the particular doctor, or because of the competition, etc., for the organization. But this man changed it all for us. He started what is called ICHOM. I don't know how many of you are familiar with this. This is the International Consortium for Health Outcome Measurement. And the people who, this is a non-profit organization, of course, and there are three basic partners. Harvard, through the Institute of Strategy and Competitiveness, which is headed by Michael Porter himself, Boston Consultancy Group, BCG, and the Karolinska Institute, probably the best known institute in Europe. And over a period of time, that's my colleague, Dr. Vishnu Parigre, quietly sitting there, we got in partnership with Vital Health, which is the ICHOM certified supplier, in June 2015. And we got what is called the Quest Manager from them, which ensures conformance to all ICHOM requirements and adds patient-reported outcome measures, PROM as we call them, and flexibility provided to suit Indian requirements. And Fortis outcome data was validated, therefore, by Vital Health, which means ICHOM would certify that this data is true. So you can rely on the data that we are giving, not because we say it, but because it conforms to ICHOM parameters, and they give you this. Their outcome portal, Quest Manager, looks something like this. So I'm not going to go into detail because I can see the clock ticking, but as you can see, this is exactly how they would measure data in any European hospital, any American hospital, whatever international norms ICHOM decides are there. There are other agencies too, but Michael Porter will. Who is going to challenge Michael Porter? And Fortis became the first healthcare provider in Asia to publish its clinical outcome data on its website. So this was data that is validated data, not because I am saying so, I am so and so, I'm the biggest cardiac surgeon, I'm the biggest total knee replacement guy. And these cardiac outcomes are now routinely published on the website. You can go on the Fortis website and you'll find data available on this, which is actually certified data. So this is how the data looks like, and it compares data with the US National Registry. In case of cardiac, it compares with Cleveland Clinic, and whichever data the ICHOM certifies or Vital Health certifies, that is relevant data for that particular agency. So from use of internal thoracic artery for coronary artery bypass, to how many times the aortic balloon pump has been used, to mortality. Every data is available, shared on this Quest Manager, with Vital Health and with ICHOM, and you get the data that you want. For the last 1 year, at another hospital of ours in Delhi, we've been measuring the mortality data and data related to kidney transplants. Slowly, it is spreading to almost all our hospitals, and the data that we measure includes data on CABG, PTCA, TKR, kidney transplant, radiation oncology, and ERCP currently. Pilots are being run on liver transplant and heart transplant. Now you'll say heart transplant, how many heart transplants take place in this country? Where is there going to be enough data? Well, I think many of you might know that Fortis does the largest number of heart transplants in this country and possibly in Asia. Our hospital in Chennai, Fortis Malal Hospital, Dr. K.R. Balakrishnan alone does 8 to 9 heart transplants every month. In the last 2.5 years, the man has done 150 transplants in Asia. It's the largest number. So I think of all organizations, we have that. We have the data, and it's our duty, therefore, to share it with the public at large, that heart transplant is being done in this country. Heart transplant is being done enough number of times for us to actually have some expertise in it to talk about our data and compare it. Liver transplant, of course, is another area that we are now focusing on. And the plan are spinal disc surgery, prostate cancer, robotic surgery. We are very big in robotic surgery. Almost all regions we have robotics. Incidentally, heart transplant, the largest number done in Maharashtra, is also in Fortis Bombay Hospital. Our key focus areas, therefore, are clinician. Sorry, I know my time is up. Actually, you're acting like God, but thank you. That's why I have physicians from all walks of life lined up. Sandeep, who's been my physician, and Dr. Shakti Gupta will probably see to it that I reach aims very soon. Now, this is a recently added thing, and this gives a lot of confidence, not just to us who are following the data, but also to the clinician. The approval rights for this electronic validation of the data are not with that individual specific clinician who's doing the procedure, but it is procedure-specific data, not a consultant-specific data. This is how a functional report generation occurs. So you have absolutely clear idea by just a quick glance looking at it, what is the post-op complication in a CABG patient, in a PTCA patient, and what is the risk categorization. I'm hurrying up, but I'll conclude by saying that implementation of ICHOM standards has helped Fortis Clinical Excellence Program in improving patient engagement and strengthening our commitment to a core value of patient centricity. This is not just Fortis core value of patient centricity. I think each one of us clinicians or healthcare organizations exist only for one reason, and that is to be having the patient in the center. And validation and certification of our clinical outcome data by Vital Health as an ICHOM's certified supplier just adds confidence to our claim of being leaders in this space. And we are the first healthcare chain in India to publish our clinical outcomes on the website. Thank you for the time that you've given.